We will begin in about 4 minutes. That deep. We will be beginning in about 2 minutes. All right, Tracy, I just got 2 o'clock on my computer screen here. So if you want to introduce us, we'll get started.
Good afternoon, and thank you all for joining us today. My name is Tracy Aaron. I'm a Health Education Director at the Lake Cumberland District Health Department. Today is September the 3rd, and we are going to be talking about an update of COVID-19 across the 10 counties. I am going to start off by sharing with you, or turning it over to you, Sean, and let you share some updates from last week.
Okay, so district-wide, I'm looking at our situation board here. So you're getting the profile view. We're up to 272 cases in Adair. Of those, we've had 19 deaths and 237 released, leaving 16 active cases, 14 on home isolation, 2 in the hospital. KC, 252 cases, 16 deaths, 219 released, leaving 17 active cases, 15 of those isolated and 2 in the hospital. 71 total cases in Clinton, 1 death, 61 released, 9 active cases. Of those, 7 are home isolated and 2 in the hospital. 90 total cases in Cumberland with 0 deaths, 79 released, leaving 11 active cases, 10 isolated, 1 in the hospital. 175 in Greene, 8 deaths, 91 released, 76 active cases, 71 of those isolated and 5 in the hospital. 102 from Macquarie with 0 deaths, 60 released, 42 still active, 41 isolated, and 1 in the hospital. Pulaski, 564 total, 7 deaths, 441 released, 116 active, 113 isolated, and 3 in the hospital. 195 total cases for Russell, 6 deaths, 150 released, leaving 39 active, 37 isolated, 2 in the hospital. Baylor has 207 total with 5 deaths, 171 released, leaving 31 active, 27 of those isolated, 4 in the hospital. 97 total cases for Wayne, 0 deaths, 85 released, 12 still active, 11 isolated, 1 in the hospital. I think this is the first time we've had someone from all 10 of our counties hospitalized all at the same time. We have a total of 23 hospitalizations right now, and 346 on home isolation for district-wide 369 active cases. We've released 1,594 cases in our district. We've had 62 deaths for a total of 2,025 cases so far. Last week I mentioned this. This week we've gotten now, as of this morning, we've crossed, or as of last night, we crossed the 2,000 mark. It took us 113 days to get to 500. It took 20 days to get to the next 500, 20 days to get to the next 500 block of 1,500, and only 14 days to get to the next 500 block 2,000, which is 2,025. So it is growing, and as I said last week, the concern is, as it grows so quickly, you're going to have a certain amount of hospitalizations, a certain amount of mortality. It's just you're spreading that over a much shorter span of time. So the chances of overwhelming your medical system is greater when it's growing so quickly. And of course, the chance of overwhelming the health department's ability to respond increases too. We've only got so many employees and so many hours in the day to be able to do contact tracing. Of course, the point of doing the contact tracing, we reach out to anyone who's been a close contact of a positive case, and if they're high risk of having contracted the disease, we quarantine them. And should they convert to a case, they're already quarantined, so in theory, they're quarantined before they become contagious, and that's one of the ways we help control the spread. I could say more about that, but I think everything I would say is going to be blended into these first couple questions, so I'll drop off there with the introductions. Dr. Wayman, do you have any introductory thoughts? No? All right, Tracy, we'll turn it over to you. I'll remind we've got 41 watching live, so if you have a question, you can type it in the chat box, and we'll try to answer those too if we can as we go along.
Okay, first question. I've heard from a couple of people who said they tested positive but were asymptomatic, but believed they were listed as symptomatic. They took the test as a precaution before any activity I can't talk today, excuse me. They took the test as a precaution before any activity had upcoming, not because of health issues. Are you aware of identifying asymptomatic people and that being an issue in the data collection and they considered a positive case?
Every day when we do our daily brief, we list the number of our patients who are asymptomatic, or at least who of the new cases that were asymptomatic. And so, it's not anything that we try to hide or deceive the public about. I'm not aware of any cases that have been misidentified as symptomatic as opposed to asymptomatic. What I wrote in my response as I was thinking about this, I said from a certain point of view, it would be easier to respond to COVID-19 if everyone who had it were symptomatic, because they would be much easier to identify and isolate. When you have non-diagnosed positive cases who are asymptomatic spreading the disease, that's a concern. We're still experiencing a significant community spread, and so it's obvious public health, the health department doesn't know about every positive case in our community. If we knew about every positive case, we would isolate all of them and COVID-19 would burn itself out. It's the non-diagnosed asymptomatic spread that keeps this thing churning along. So that's why we keep saying to everyone, it's really, really important that you use the common sense precautions to keep your distance, try to avoid crowds, wash your hands, wear your face mask, and not be touching your face and things along that line, because obviously it's spreading because, if we had isolated everyone that had it, it would just burn itself out.
Thank you. The Beshears administration has mentioned Greene County schools more than once after the district opened to in-class learning, only to close shortly thereafter. Are any of the positive cases in Greene County linked to being spread while school was in session?
Okay, when I reviewed this, it was yesterday before yesterday's numbers came in. So as of the time I reviewed the data yesterday afternoon, I don't think that we've had any spread while school was in session. When I looked at this, we had 68 positive cases in Greene. Of course, right now we're higher than that. We have 76 now, but when I looked at it, we had 64 or 68, and 64 of those were self-isolated, 4 were in the hospital. Of those 68 positive cases, 3 were full-aged, and what I mean by that's 5 to 18. And I could see that one other case, besides being school-aged, there was a school employee that was a case. But as far as I know from looking at the data, it didn't happen there wasn't transmission while school was in session. We, of course, worry about asymptomatic spread. And when schools go in person live and you've got hundreds of people in a confined space for several hours a day, we do worry about asymptomatic spread and, students catching it and taking it home to maybe their parents and their parents taking it to church or to work or whatever. We would expect we're going to see a spike in cases a few weeks after the schools go at, community spike. That's a few weeks after the schools go back to in-person instruction. Of course, the schools may see spikes in cases immediately inside the school setting.
Okay, thank you. Public Health has asked us to take precautions to prevent the spread of COVID by wearing a mask and social distancing. Nursing home is the most controlled situation where residents are not mobile and or socializing, and staff members are wearing extensive PPE. Understanding the population of individuals, they are more vulnerable, and many are asymptomatic. It appears these measures are not proving effective. At what point will the Lake Cumberland District Health Department and public health officials reevaluate the process?
It depends on how you want to define ineffective. There's no doubt that taking the precautions reduce the risk. Taking the precautions do not eliminate the risk. We've never said that it does. You're always reducing your risk by wearing a mask and keeping your distance and by, washing up and avoiding crowds. There's always a chance you can run into a store for just a moment and someone sneezes on you, and there was just nothing you could do about that. You took every precaution you could and you still caught it. Or you could be masked up and with somebody and they have it and you're with them enough and it gets around the mask and you breathe it in. It's all designed to reduce the risk. It is effective in reducing the risk, but it doesn't eliminate the risk. There's other places besides nursing homes where, tight controls have been in place and we still had COVID clusters. We've had COVID clusters in hospitals and medical facilities, even in our own health departments. In our own health departments, we've had to close a couple down for a week and sanitize and send employees home to make sure that they didn't accidentally catch it from somebody who may have had it who was asymptomatic. So it gets in. I know in our situation we had fewer people reporting to the office. They were spread out. They were wearing their masks. It still got into the facility and it still spread among the staff. So it's not just nursing homes that struggle, but certainly these things help. I mean, we've had other situations, very large factories and things that have had cases that didn't turn into a cluster because they were using the precautions. So don't stop using them because they don't completely eliminate the risk. Do these things to reduce the risk. I don't know, Dr. Wayman, you want to add anything to that?
Perfect as usual, Sean.
Thank you.
All right, next question. A number of businesses are still not enforcing the mask mandate. Can the health district comment on whether any businesses in the 10-county area has been fined or actions taken against them they're not complying?
So yesterday we was to the point of getting there with some written warnings, which would be just before the fining step. We've not fined anyone yet, and we were able to actually work that one out. So we're still, of course, working daily with the businesses to reinforce the importance of wearing masks, and any businesses other than those that are regulated normally by the health department, we refer those to Department of Labor for follow-up. So if it's a business that's not normally regulated by us, such as hardware stores or parts stores, those we have to send to Department for Labor. We look more into places like your food service businesses, restaurants, and things like that we normally regulate.
We're certainly not excited to fine anybody. We would much rather find some alternative to encourage compliance than fining anyone. I have no doubt before this is over, we'll have situations where you have to fine people, but we would much rather just reach out to them and educate them and they'll see the light and follow the guidance. So.
Okay, thank you all. Are the positive test results strictly COVID-19 or is it all coronaviruses? Dr. Wayman, I think that's you.
All nucleic acid and protein tests, which includes PCRs and antigen tests, are specific for COVID-19.
So some tests are specific for COVID-19. Some tests could identify other coronaviruses.
All the PCRs and all the antigen tests are specific for COVID-19.
Which is basically what people are using now. So that they've been fine-tuned to the point where they're effective to just narrow in on COVID-19.
Correct.
I think early on in the outbreak, that was a problem with the types of testing they were using early on.
More with the antibody tests that you may get cross-reactivity, but not so much with these. These are quite specific.
So we've gotten better over time. The response has gotten better over time with narrowing it down to COVID-19. All right.
Okay, next question. This was for you also, Dr. Wayman.
Actually, I gave that one to Sean.
Okay, all right. Well, CDC recently released numbers of directly related COVID-19 deaths that contradict the number of deaths in Kentucky. There is a post going around that says there are only 110 direct COVID-19 deaths, but the number from the state says the numbers from the state are saying in the 900s.
Yeah, and I think what the confusion is, there are, only a certain number of cases where on the death certificate, the only cause of the death is listed as COVID-19. Most deaths with COVID-19 as the main factor for the death has other comorbidities listed along with it, which that is not uncommon regardless of the disease someone dies from. Any disease is going to, attack someone with vulnerabilities more so than someone that doesn't have those health vulnerabilities. So it's not uncommon in any situation when a disease kills someone for the comorbidities listed. So, I think people that just want to not believe COVID-19 is a problem looks for everything they can to try to explain it away. But there's plenty of deaths that the primary cause is is COVID-19. Just because some comorbidities are listed doesn't mean COVID-19 wasn't the primary cause. And again, that's a common way that the death certificates are written for disease-related deaths. Right now, the most vulnerable population is the elderly, those with cancer, kidney disease, COPD, a breathing disorder, when your immune system is compromised, obesity, heart disease, diabetes, all of these things. If you have these things, your chances of having negative outcomes if you get COVID-19 go up. So, you know, it's going to have a harder impact, chances are, for people who have these other complications. So, you know, if you have diabetes and you catch COVID-19, and that's the reason why you die, you know, a comorbidity might be listed with something diabetes related. Again, that's not an uncommon way that things are done. Dr. Williams, you want to add something to that, or is that correct?
I think CDC just pulled out the deaths that only had COVID written on them.
Yeah.
So most of the time, just like what Dr. Wayne was saying, if you die of a heart attack in the hospital, they're going to list, that may be the main one, but then they're going to list other things along. If you have kidney disease or if you have diabetes, those things are going to be listed also. Now, the state does take out, there's a lot of rumor going around that somebody died in a motorcycle wreck and they listed COVID. And that's not true. That's not true. Though the state has a committee of people, and these people aren't in it for, you know, they aren't in it to broaden the numbers or do any kind of making the numbers look different. You know, they take out and remove anything like that. I mean, they look at all these deaths and review these deaths to make sure that they're putting these in the right spot, if they belong in a COVID-related death or if they don't.
I don't know why my mind goes to this, but, you know, there's a significant group, I don't know how significant, it's probably a minority, but it's a significant minority of people that seem to be of the mindset, well, it's the elderly people and the sick people that's dying from this, and they're going to die anyway, and, you know, kind of just be dismissive. But so far, I've not talked to anyone that's wants to give away one day of life. You know, they want to live as long as they can, and that we would be so willing to throw away someone else's, you know, years of life they have left because we don't want to wear a mask. I mean, it's mind-boggling to me to be so, I don't know what the right word is, about it, dismissive of other people's health, and it seems to me like a pretty small inconvenience. But, yeah.
It really is, because, I mean, if you think about it, I mean, there's still a lot of people that are in their 70s out there working. My dad's 70 years old, and I mean, there's not a lot wrong with him, and I don't want, you know, I wouldn't want him to get this and lose him because of that. I don't think he's ready to die yet, you know, or somebody who, you know, might be much older. I have a father-in-law who's 87 years old, farms every day. I don't think he's ready to die yet. He's still out. I watch him work hard, and I don't want him in these numbers.
You know, I see one political group go to the extreme, it seems like, wanting to shut everything down, and one go to the extreme of seeming like wanting everything to be back to normal. When the truth is in the middle, you know, use common sense and try to keep your distance from crowds, wear your masks. You know, in most instances, you can go about life pretty much normal if you just take some normal precautions. But this has been politicized the way it has been and become something that politicians are fighting over and people on social media are fighting over, and the news is, depending on which news channel you want to read your article from or listen to, you know, there's spins on something that seems to me like everyone would just be concerned about people being healthy and just say, you know, let's all agree that these common sense things can help, and let's do that. But it's the world we live in.
Okay, next question. I have been hearing that it's possible to have COVID-19 after you have recovered from it from the first time. Is this true?
Yes, there is documentation of 3 cases that actually were reinfections. And we know they were reinfections because they actually cultured the virus and it was a different strain. We also know that the antibodies wane after about 3 months. We don't totally understand the whole immunology yet. So yes, it's possible, but so far it's been quite rare.
Okay,
But
thank you.
you and I talked about this, Dr. Wayman, that once a vaccine gets developed, because of those things, it may end up becoming like an annual vaccine. So, because your immunity might wane, or the virus might evolve enough to where you're going to recatch it. So, you know, be like chasing the flu virus every year. You have to come up with a new vaccine each year. But anyway, I'm still hopeful, looking forward to a vaccine, and whether it's an annual vaccine or a one-time vaccine, I'm certainly excited about transitioning to some other situation than what we're doing now, trying to control the spread. I'd like to do some vaccinating and do something a little different.
Is there any major proof that antibodies from a person that has recovered from COVID-19 can save another person's life with COVID?
Studies are encouraging, but they are still ongoing. So the final word is still out there. So I think you just have to wait a little longer to find out whether it actually works or not.
Okay. I hear a lot of doctors are already encouraging their patients to receive the regular flu shot. Do you think there will be a rise in deaths from COVID when flu season begins?
Yes, I do. I think that if you catch COVID and the flu, you're much more likely to die or get very sick. And so, yes, I think everybody should get the flu shot, so at least they're covered for one disease while trying to avoid the other one.
It would be one of those comorbidity situations where, man, it would be tough getting both at the same time. So if you can avoid at least one of them, do.
And the other thing is it makes it harder for healthcare providers to diagnose because the symptoms are similar. So, you know, you can actually treat the flu with antivirals, and we're not entirely sure whether we're treating coronavirus with antivirals. There is some encouragement in that arena.
So everybody needs to get their flu shot soon, Dr. Wayman, right?
Yes, ma'am.
Okay, next question. If a city sponsors an event such as a trunk or treat, would they be liable if there was a spread of COVID? And then also, is there any guidance on Halloween events or if counties will have Halloween trick or treat this year?
I'll answer part of this and Stuart will answer part. He can answer as far as the guidance part, and I'll answer the legal part. Do you have any guidance?
As far as right now, we don't have any guidance on doing the Halloween and the trick or treat. You know, we do have some other guidance that might work into things like venues, and there is some guidance out there by Department for Education about the school settings and things and how we would do things in schools. And then there's guidance about childcare, daycare. And I think that taking a lot of that stuff together, you know, we could come up with some good things. But I actually believe Halloween's a couple of months away. So we need to, you know, one thing, we need to wait and see what happens here. You know, we're not sure where we'll be at when Halloween does get here. But I do expect that Department for Public Health will issue some guidance by the time Halloween gets here or before Halloween gets here, so we'll know what to do, and of course we'll be able to go through those things to look at different plans like we do for everybody. For any type of event that goes on, we're able to look at plans and we're able to give suggestions and feedback and best practices.
As far as the legal side of it, none of us in this room are attorneys. So we're not really qualified to give any sort of legal advice. You know, what I'm about to say is just a layperson's opinion. My opinion is no better than anyone else's. So I will make that clear. This is not legal advice. It's one person's individual personal opinion. You know, it seems to me in this world we live in, there's an awful lot of people that like to sue others for an awful lot of reasons. And if I were a business owner or a school board or you know, someone planning an event, you know, whatever the situation is, you know, understanding the world we live in and that there's you know, a lot of potential to get sued in this world these days when things go wrong. I'm not so sure I would want to be out of line with the public health guidance of the day. It would seem to me that that would lend some fuel to the fire of whoever was bringing the charges against you, saying, you know, these precautions were commonly known and you disregarded them. Again, layperson's opinion, not an attorney. I sure don't want anyone to think that's legal advice. But to me, it seems like you would, you know, you're taking some additional risk on yourself by disregarding the public health advice.
Okay, thank you both. Next question. My child tested positive last Monday. We got the call from the health department on Thursday. They have him quarantined for 10 days. The way I understand them, which is the health department, it is 10 days from the day he started showing symptoms, which was Sunday. Luckily, his symptoms were mild and there has been no complications. The rest of us, the family, is quarantined for his 10 days plus another 14 days due to the incubation period. I'm still not really clear on that one, but we were told he would be able to be released from quarantine. No test was needed, but the rest of us would not. The rest of us tested negative when he tested positive. It seems to me that he should be tested to make sure he's still not positive before turning him out in public. As you can tell, I'm totally confused with all of this. Can you give some insight or clarify the directions, Dr. Wayman, for this family?
So let's,
You left a little out. They said they were totally confused by this whole mess. Now, let me tell you, we feel like it's a big mess sometimes too. You know, it's a lot. It's confusing, and I understand how people can be confused by it. So don't feel bad that this is confusing to you. Dr. Wayman, go ahead and answer.
well, let's answer the second question first, which is why isn't he being tested? It's because the COVID PCR tests are very sensitive and they detect very tiny amounts of viral RNA. And this RNA can be from a viable virus or a non-viable virus. So most people who are recovered can still have positive tests, which is not very helpful in us determining if they're contagious or not. But we know historically that they are not contagious, providing they have recovered. And that's why we don't test.
When you say a non-viable virus, my way of explaining that is the virus has died, but there's remnants of it still in your body.
There you go, or in your nose, or
And the test can still pick that up, even though it's dead and you're not contagious anymore. It's died off. You're not going to spread it.
correct.
It's not viable, but it'll still show positive because those tests are so sensitive.
And you can show positive for weeks. That's why it's not a very good test for recovery. As far as quarantine and isolation are concerned, we isolate cases, people who are infected, for 10 days, because we've learned that they are no longer contagious around 10 days, providing they're improving. We quarantine people for 14 days because that's how long it takes for the virus to show itself. That is the incubation period if you become infected. And we want to prevent you infecting others during the pre-symptom phase. So that's why it ends up being different, and the terms are different. For cases, we use isolation, and for contacts, we use quarantine. we add 14 days to the last day of somebody being infectious, especially for a household contact, so that if your son had to be isolated for 10 days, you had to add 14 days to that 10 days.
And just to give a personal example, you know, we had a cluster in one of our health departments, and assuming that the staff were all exposed at work, which, you know, it could theoretically not have, but assuming the exposure all happened at work, the length of time it took each employee to show symptoms was very different. And some of them, you know, was at the very end of that 14 days before they started showing symptoms. So, you know, that's the reason why we do it. The person who was sick, as long as they're improving, research is showing 10 days after they're good to be released. But if you're someone who's been exposed, it could pop up 14 days later. So, you know, if 10 days is the end of their period where they could be spreading it, then for you, if you got it on their last day, it might not show up in you until 14 days after that. And we've seen that a similar thing happen in real life in one of our clusters in the health department. So,
And that's the same with any of these types of diseases. So anytime that you're exposed, when you're exposed to something, you're not going to immediately get sick. It's the same with, it's not the last thing you ate that makes you sick a lot of times. It's what you ate 48 hours ago that ends up making you sick, or 72 hours ago. Because once you get that virus in your body, then it takes a while for it to build up enough to make you sick. So, you know, and with coronavirus is a 2-day pre-symptomatic. You can still be shedding that virus to somebody else. So you're not even sick for 2 more days yourself, but you've shed that virus for 2 days before you became sick to other people. And it works that way with all kinds of viruses. I mean, it's the same way with rabies. It's the same way with the flu, with foodborne illnesses. It works the same way. It's not necessarily a mystery. I mean, this is working like other viruses that we see, and that's why we do these things. And quarantine's not a mystery. You know, we quarantine animals that has bit people for 10 days that we know that in 10 days that they're going to show those signs of rabies. They're probably going to die. Rabies is a disease that an animal dies from and a human dies from. And we know that if we're watching for that 10-day period, we're watching to see what happens. And we know then, do we need to vaccinate? Do we not need to vaccinate? What goes on? So these things are tried and true. They're old methods. I mean, the same methods we've been using for years and years and years and years.
like I said, 4,000 years ago in the Bible, you know, God gave a law to quarantine people that had infectious skin diseases. I mean, quarantine is not a new concept. It's been around as long as we have books to read, you know, so it's not a new concept. Tracy might remind people, or I will, since I got the floor, that we're getting close to our last question. And if you want to type something in the chat box, now's the time to do it.
And we have one
I
last
think the last
question.
question has already been answered.
There's one more question on the sheet.
The same one about the PCR tests. Effectively, why do we not retest?
Yeah, I think you just answered that, Dr. Wayman.
Yeah. And on the question, really, they had said quarantine, but you had been in isolation, you know, for that. So you'd have been a case.
Yeah, we use the term isolation for a positive case, and we use the term quarantine for a contact.
So the question that you're all talking about is, why don't you have to retest to be released from quarantine? And that's what you're all referring to as you're talking now.
Well, I think it really meant to say, why don't you have to be retest to be released from isolation as a case, which I've already answered, that tests are very sensitive.
We do have 60 people watching live. As far as I can see, by watching YouTube Live here, there's no one that's typed a question in the chat. Someone just typed in, thank you for your updates, and we appreciate your appreciating our updates. It takes about, YouTube's about on a 20-second delay, so I'm going to make some closing comments and watch to make sure there's no last minute questions.
Hey, Sean, before you do, I just want to point out, you know, in this last question that Dr. Wayman was answering and talking about about the lady's child, remember, when you're exposed to something, you're not going to be able to run out and get a test right then and it show up and say that you have it. That would be a rare situation of something that you would ever be able to do that. It takes time for tests to be able to pick that up. It takes time for that load to build up to be detected by a test.
And basically, the virus reproduces inside your body, and it replicates. It multiplies inside your body, and it has to be a certain amount of buildup before.
And that's what the incubation time that we talk about, that's what that is.
Viruses are really interesting. You can watch plenty of YouTube videos about how viruses invade cells and take them over, and it's very interesting to watch. But it's not very entertaining when you're the one that's COVID-19 laid up in your house sick. So, but they are interesting subjects. Okay, so I don't see anything else. I'll end with saying, you know, we still encourage people to do the things we've been encouraging since the beginning. You know, keep your distance from crowds as much as you possibly can. The more people you're around, the more chance you're going to run into someone that has it. We know we've got more active cases isolated right now than we've ever had. 369 active cases quarantined. I said isolated. Got that wrong. 369 active cases quarantined. Obviously, if there's 369 cases that we know about, no, cases are isolated. Got it right the first time. Sorry. So we got 369 cases isolated. And obviously, if there's 369 cases we know about, there are asymptomatic people out there, since it's still growing every day, that's still spreading it. There's people out there that have it, they're spreading it we don't know about. So, you know, the more you're out around people, the more chances you're going to run into someone that gets it. So avoid crowds as much as you can. When you have to be around people, keep your distance, wear your mask, make sure you wash your hands often, and try to avoid touching your face. You know, sanitize more at home. Sanitize more just in general. You know, if you're in a store and grabbing a cart and you've got something to wipe it off with, wipe it off. Just do everything you can to reduce the risk. We started out by saying those things don't eliminate the risk, but they reduce the risk. I would certainly, you know, if I had 9 chances out of 10 that doing something would prevent it, I would rather take the 9 chances out of 10 than not. So, you know, let the odds be on your side and do the things that reduce the risk, even though it's not 100%. Any closing thoughts, Dr. Wayman or Stewart?
The only one I have is with 346 active cases, or whatever the number is, we have at least 1,000 contacts we've quarantined.
That's correct. And, you know, I didn't give an update of what we know for today. Just adding on to the numbers I read earlier, we do know there's at least 38 new cases today. We've had 1 additional death today. And there's up to 16 more on top of that 38 that's pending from a long-term care facility. So it's going to be a very large day of new cases for us, and we're adding a death. Well, I'm not sure about hospitalizations, but my hospitalizations may go up too. I just don't know. I'll have to wait and see when I get the numbers tonight. So Russell County still in the red zone. Somebody asked that question. Let me look and see on my website here. I update that every night, and I'll have to.
While Sean's looking at that, I'll do a little filler here that I wanted to add in. Remember on this, you know, we're when you go out and we're seeing places that people are still coming in and maybe not wearing that mask. you know, one, if we can get the employees of places to wear a mask, I mean, we want that, and we expect that. Now, the general public is much harder, and there is even guidance out there from even CDC that says, you know, the health department's not the police force, and the police force has other things to do rather than enforce masking. So I don't have a gun. I don't know fighting techniques, you know, to take down people. I probably, you know, about anybody out there would just give me a whipping. And they would probably make me like it. You know, so we don't want people out there getting into a conflict over mask, and we can't expect and we can't ask people to do that. We ask people, make sure to put up those masking signs. Make sure that you offer other ways, like curbside service. If somebody don't want to wear a mask, make sure that, you know, there's other things allowable, like a scarf or like a bandana or maybe like a face shield. But, you know, when it comes down to it, it's not worth wallering out there in the parking lot over, or somebody, you know, getting so angry like they do nowadays. People lose control of their tempers and somebody getting killed over that. That's, you know, there's no need for stuff like that. And if you're a person who, I went to the store today and I see a few people not wearing a mask, you know, the rest of us are looking at you. I'm thinking, what's up with that guy? What's his problem? Why won't he put a mask on? You know, if he has a medical condition, he can wear a face shield or something like that. So just don't be that person. Put a mask on. Do what you should do, or put a face shield on and do what you ought to do.
It's tiring for us. I mean, we've been dealing with this for 168 days, and it's consumed us and our employees for a long time, plus a lot of new employees we've just hired to do nothing but case investigation and contact tracing. And with all the new cases that we're getting right now, with most of our employees reassigned to be doing something COVID related, hiring a bunch of new people, we're still at the edges of our capability. So knowing that we're still having such growth, it's a fearful thing for us. To answer the lady's question, yes, Russell County, as of last night, still in the red zone, which means that they're having 7-day average spread of 25 people per 100,000 spread in their community. So that, what I mean by 7-day average, we take all of the cases for the last 7 days, divide it by 7 to get an average number of new cases per day, and then we do the math to make that show as a ratio to 100,000. We do that so that we can compare counties to counties with different populations to a common denominator. So we just make them all as a ratio to 100,000. But yes, Russell County is just over what I've got on the website's 25.51 per 100,000. So they're just out of the orange. Macquarie County is 25.7 per 100,000, and Green's there, where we're having our largest situation right now at 77 per 100,000. So they have a very, very large outbreak in a nursing home, which is adding to their numbers. I think in Macquarie County, what has pushed them over the edge was it's ultimately was a revival church-related event, a multi-week revival where there was significant spread among the congregation members and visitors. And then, those good people that go to church, they went to their home church after the revival, and now it's inside their home churches. And it's starting to pick up in people are taking it back to their home church with them. So Greene counties can be explained by a large nursing home outbreak. Macquarie County, a pretty large outbreak tied back to some churches. I'm not sure what Russell County's tying back to. Is there anything that pops out in your mind, Stuart? I know they have a long-term care, but it seems to be in control right now.
It's not seemed to be the long-term care there. I think.
So short of knowing that, I mean, it would be community spread. And most of these other counties that are orange, it's just simply community spread, meaning that we can't tie it back to any particular event. It's just spreading pretty freely through the community.
Just like Pulaski County with 441 cases, or that's, 400, that's released cases, 116 cases. We know we do have some nursing home cases, but a lot of that's community spread. And Sean, you may want to tell them again about how our data versus the state data, that there is a little bit of time discrepancy.
There is, and people ask this question very regularly. Why does the governor's numbers not line up with our numbers? And now that on the governor's website, or the Department for Public Health's website, they've got a map that shows the counties color-coded too. And usually the state's data is 2 or 3 days behind our data. If you read the daily brief in my last paragraph, I always put, what's the difference between our numbers and the state's numbers? And it's simply that they're just 2 or 3 days behind. It's not that they're doing anything wrong. They get the information on a different time interval than we do, but they validate it differently than we do too. They go through some other processes to make sure that they're not duplicate entries and so forth, but different steps before they declare that case is official. For us locally, when we get the lab confirmation, it's a case for us. And very, very rarely do we have to, have we added someone that wasn't a case. And if we do, we announce it the next day. It's more likely that we would, have someone that we say is a Russell County case that accidentally, they live on the border, and it's actually an Adair County case, because they were right at the county line. That's the most common switch we have, switching someone from one county to the next because their address was confusing. Almost never do we have a case we have to take out of our case list because they turned out not being cases. It has happened, but very rare. But they validate their data differently, so they're about 3 days behind us. So their maps will be about 2 or 3 days behind their maps. And I know sometimes it seems to me that the state will have a day where maybe the cases are a little slower, and they do some significant catch up, and they may get down to only being 1 day behind. So they may report a bunch of stuff. They may report 3 days worth of information on 1 day, and it makes it look like Pulaski County had this one huge day. Well, we reported those numbers. We just spread them out over 3 days. Where we had the information each day, and they're reporting 3 days worth on 1 day. So it makes it confusing, but the best source for local information is on our website. That's the most current information, and use that. The state data eventually will align with our data. If the spread would ever slow down enough that it would ever allow it to align. There's so many new cases each day, they're perpetually 2 or 3 days behind. Anything else? I don't see any other questions. There are 55 watching live. I think we had 60 watching live a few minutes ago, and there's usually a few hundred people that watch this on delay. So we appreciate everyone joining in live, and whoever might listen to this later on delay, thank you for listening in. Tracy, you want to wrap us up?
Yes, thank you all for joining us today. I encourage you to send questions in if you have them. You can do that at your local health department with your health educator, or at the district with Melanie Williams. And we will be back next Wednesday, which will be September the 9th at 2 o'clock. Thank you all. Have a good day.
Thank you all.